Psychological therapies for schizophrenia. CBT. So the aim of CBT in general is involves helping patients to identify their irrational thoughts and trying to change them. This can involve vigorous argument or a discussion of how likely the patient's beliefs are true and considering less threatening possibilities. During CBT, the therapies will challenge the patient's interpretation of events by testing the validity of it through empirical argument, and this will help to change their pathological thinking. Patients learn to consider alternative ways to explain why they feel and behave the way that they do. CBT helps patients to think more positively and to cope with their symptoms. They are set behaviour assignments to help their general level of thinking. Research to support CBT comes from the NICE study, NICE. The NICE review of treatments for schizophrenia found consistent evidence when compared to antipsychotic medication alone. CBT was effective in reducing relapse rates up to 18 months following the end of the treatment. In comparison to the standard care, CBT was shown to effectively reduce symptom severity and improve their social functioning. This shows that CBT is an effective treatment, better than antipsychotic drug treatment, which has major side effects. CBT is a non-invasive treatment. It doesn't change your brain's neurochemistry, and this increases the support and its appropriateness. However, a methodological criticism of CBT is most of these studies that were used, the effectiveness of CBT has been conducted with patients treated at the same time with antipsychotic medication. It's difficult, therefore, to assess the effectiveness of CBT independent of antipsychotic medication. It may be better to have used an independent groups designed to reduce order effects. This would increase the validity of the study, as the studies used may reduce the support for CBT. Ethical issues with CBT. Although it may challenge a person's paranoia, it may interfere with their freedom of thought. If, for example, CBT challenges a person's beliefs about a controlling government, that could state in modifying their political views. Such ethical issues like this make psychological therapies for schizophrenia less appropriate. This reduces the support for CBT for schizophrenia. Another weakness is that CBT may help but not cure schizophrenia. CBT helps patients to make sense of their symptoms but doesn't cure it.